steadily invading our lives, changing the way we work, we plan, travel, and you name it. And healthcare is no exception. Robotics guided surgery has enabled the performance of highly intricate surgeries and saved many a life. But, however high precision, will machines get the job of healthcare done without human insights and empathy? Are the days of the family doctor who could detect the most underlying disease by reading our pulse lost forever? What is our stance on human to human interaction? Through today's session, Mind versus Machine, AI in Healthcare, our learned speakers will explain, analyze, and solve this dilemma. Our speakers this afternoon hail from across the healthcare spectrum. DVS Somaraju, Executive Director, SLG Hospitals, Dr. V. Jagan Mohan Reddy, Orthopedic Surgeon, Dr. Pradeep Panigrahi, Medical Director and GI and Laparoscopic Surgeon, Karan Verma from Wipro GE Healthcare, and Merve Igets from Electa. Conversing with them is Sriram Curry, Resident Editor at Deccan Chronicle. Before we move on, I request Akhilesh to play the speaker introduction slides that you have with you. Thank you, Akhilesh. I'll hand you over to Sriram Curry to begin the conversation.
I thank you so much, Priya, and welcome everybody. Yet another fascinating theme on which we all engaged today. The whole issue of technology has always been like a double-edged sword historically. Uh, some of you might have interest in that kind of reading. Samuel Butler wrote this book called Airborne back 250 years ago. Airborne is nowhere spelled the other way around. And 250 years ago, Samuel Butler spoke about machines being the next step in evolution of human beings, the masters who will eventually enslave mankind. Throughout history, as mankind progressed with giant technological breakthroughs, products, ideas, concepts at work that changed our lives, they did not come in and were received very easily. There were a lot of doubts, a lot of perceptions of threat. The steam engine was considered the devil. Anesthesia was considered evil. Surgery was considered an act against God. In more recent times, the very notion of cloning has created so much of fear, possibly drawn from perhaps popular portrayal in movies, in books, the Frankenstein that breaks loose and destroys the maker himself. Or you would remember Jurassic Park as an idea and its larger underlying themes of fear. I think we are yet waiting for those extraordinary movies in the next few years where the villain would be artificial intelligence, a set of code, zeros and ones arranged in a particular way. That perhaps this fear of robots, this fear of such intelligent machines that they perhaps can wreck our world. But such fears aside, technology has made life easier, beautiful. Human beings have benefited in every aspect of our life, that we've been enriched because of these great ideas. Today, in the backdrop of a larger global pandemic, where health and healthcare have become the biggest concerns and priorities of individuals, of families, of societies, of governments, and the world together, we are going to have this extraordinary theme for a discussion, man versus machine, in specific applied to healthcare itself. Before I get into more specific questions to each of our panelists, and here we are represented in two ways. One by the doctors, the visionaries of healthcare who understand how technology is making an impact and where the future lies on one hand. And on the other, representatives of that disruptive, innovation-led technology industry is working on applying the knowledge of technology, their breakthroughs through products, services, progress we may expect in times to come. How do these two fuse? And it's rather extraordinary because this is one area where technology will eventually benefit patients, but they will not be deciding on the use of technology. It will be the doctors. So their comprehension, their perception on how technology can aid their practice of making lives healthier, to detect disease, to prevent it, and to make cure easier, faster, less painful, are also very crucial. So we have both people from the healthcare industry and the technology industry. Together, they will give us a sense of man-machine, its fusion in making the human body more healthy. So my first question to all the speakers, like an introductory remark of a minute or less perhaps, how do you perceive this? Is it man versus machine? Is it man and machine against disease? To what extent is technology a boon? At what point of prowess of technology do you begin to feel a little concerned? So this is my broad thought. I'll begin, no specific order. Each question will change the order perhaps for just variety. I'll begin with you, Dr. Jaganmohan Reddy. If you could give us a sense of man versus machine, and then we'll move on to Dr. Pradeep and Dr. Somaraju then, and perhaps Merv and Karan in that order. Dr. Jaganmohan Reddy.
Sir, small request. Dr. Jagan got some emergency surgery, which he is about to complete. I think he will join in another 10 to 15 minutes. So can we redo that thing and so he can come and join us?
Sure, Dr. Somaraju.
That is the last minute information.
Sure, that's absolutely. So, Dr. Somaraju, let me throw the gauntlet to you, and could you get the ball rolling for us?
Okay.
Technology in your area.
So first of all, let me clarify: I'm not a doctor. I'm the executive director of SLG Hospitals. So when we have recently opened this hospital a year and a half year back. So when I was, because I am not from the veterinary medical field, I had done a lot of research and survey on various technologies and the companies, how they are functioning. So in that course of time, I must have met many senior doctors and all. Most of the senior doctors, they said, no, don't invest too much money in technology, because if you invest money on a 64 slides CT or 128 slides CT, which is the latest, the technology is same, the film is same, only quality, little difference, not even 5% and all. But somehow I was not very convinced, but I have invested little more in the technology wise. So the younger generation of the doctors, what they really feel nowadays. See, for example, if we have done a CT in a 128 slide or a MRI in 3 Tesla, what happens, the quality of the film or the diagnostic system of the system will be very clear. Once that system is very clear, that it is very easy for the doctors to get into a right treatment from the day one. So because of that, the treatment quality also improves. So I think if I'm wrong, let Dr. Panigraha to clarify on that. If I'm wrong, or my decision is correct, let the panels decide. This is not my opinion.
Dr. Pradeep Pranigri.
Yes, Mr. Sriram. Good afternoon, all. Thank you for this opportunity of being a panelist for such a beautiful topic, wonderful topic, and a escalating topic. Where, as Mr. Sriram said, is it man versus machine or man with machine versus diseases? I support your second point, Mr. Ram. Absolutely, it is the man with machine versus the diseases. Currently, actually, we have to accept it that technology is a part of life. It is going to change the social status, economical status, the topography, as well as the healthcare. So, a lot of changes are going to happen, and we have to accept it. But of course, all technology or anything new, what we are going to introduce, will have pros and cons. So we have to balance between the pros and cons and give a direction. See, it's the man who controls the machines. It's the man who has designed the AI or artificial intelligence. It is the man's brain which has done it. So obviously, the control should be the master control, that is the man. And once the master control is the man, so we getting a deviation or distraction, chance will be big. So advantages will be more than disadvantages. This will be my notion. And at the advert, let me thank our AD sir, Samraju sir, who actually visualized it and took the hospital in that direction. The amount of investment or structuring or thought process put into it is much ahead of this era. Whether you take it as operation theater, whether you take it as the operation OPD areas, or whether you take it as a diagnostic center, it's all state of art and ahead of what we visualize. Now coming to back to the use of artificial intelligence. People usually feel that it's a artificial intelligence means we think that robot assisted surgeries or a precisions or a neuro guided surgeries or a robotic guided neurosurgery or a diagnostic modalities like CT, MRI or other lab diagnostics. But actually artificial intelligence has a lot to do. Basically, it's a enormous data which has been fed into the machine, which actually analyzes, processes, and then finally gives an outcome, a guidance to the clinicians to implement it and give it a direction to our stakeholders, our patients, who actually are eagerly waiting for these technological advances to be used to them so that they get the best out of it.
Thank you, Dr. Pradeep. Karan, I'd like to now move to you. You obviously represent the industry that will provide these technologies to the doctors, to hospitals. How do you view this? Dr. Pradeep said that man has made the technology and is in control. Today, I don't know how many of you feel the mobile controls you more than you control it. So, with that caveat, and ask a 5-year-old to leave the video game, you don't know who's in control. With that caveat, I'd like to come to you, Karan.
Yeah, I agree. I remember when my second son was born, which was 7 years back. The first appliance he used was an iPad, and the first time that he happened to see TV, he was trying to touch the screen and see if he's able to produce. I absolutely agree. But I think, the question at hand, I know you spoke about unprecedented improvements which have happened. At the same time, is it possible that the machine will turn against man? I think that word, even if it's a possibility, is probably 40, 50 years away. And I think what we can pragmatically and realistically talk of today, even if we talk of AI, it's something which is going to enhance, improve, assist the clinicians, the radiologists today. And that's our view at GE Healthcare. All the solutions, whether we are making in-house or we are working with the larger ecosystem of startups to bring to the market, the whole premise is the role of the clinicians, the role of the doctors is absolutely central to the entire workflow that a patient experiences. In fact, to your point, so I agree with Dr. Banigari that it's man plus machine versus the disease, right? And that's really the whole premise. And Mr. Somaraju, I think thank you so much for partnering with GE in terms of selecting. It's not just about saying I will spend the maximum amount of money on the machines, right? It's about saying for the kind of care, for the kind of clinical workflow, for the kind of clinical outcomes that I want to deliver, what's the right technology? And GE Healthcare takes proud in partnering with customers like SLG to really help understand from an India perspective where the care of the level of care and the outcomes you want are quite different from what you would want to do in other markets. We work very closely to understand what is the right technology, right? So it's definitely man plus machine versus the disease.
Thank you, Karan. Merv, did I get the pronunciation right? Merv Aygıt.
Merve Aygıt, actually. So
Okay.
I hope you can also see me. So thanks for the opportunity again for to be a panelist in this discussion. And well, actually, in terms of the AI, like that, we are all aware that it's like in the healthcare industry is ripe for some major changes, like from chronic disease and cancer to radiology and risk assessment. And there are nearly endless opportunities to leverage those technologies to deploy more precise, efficient, and impactful interventions at exactly the right moment in the patient's care. So, like in terms of when we look at the AI side, the AI offers a number of advantages over like a traditional analytics and clinical decision-making techniques. And learning algorithms can like become more precise and accurate as they interact with training data, allowing humans to gain unpredicted insights into diagnostics, care process, treatment variability, and patient outcomes as well. And for key challenges for the translation of AI systems in healthcare include those in strength to the science of machine learning, uh, logistical difficulties in implementation, and also consideration of the barriers to adoption as well as the necessary social cultural or the pathway changes. So, like, as we all know that AI is not going to solve all the big problems we have in the healthcare, but as you were asking, it is like the man versus machines or man with machines versus disease. With the second option, uh, like solving all the problems together with AI plus man will also work. And in terms of like the Electa, you know, we in Electa we are in the radiation therapy and neurological disease perspective. We are promoting the precision radiation medicine, which also had our patients using the AI tools to have a more precise radiation therapy.
So I was just reading this statement of the president of your company, Electa, and she said the belief of your organization is like your motto, and leitmotif. We are going to be here till cancer is not here. So you obviously work a lot on oncology. So could you
Yeah.
just give me a couple of specific instances of use of technology to make eventual cancer care and management better?
Yeah, well, actually, it's our, as you mentioned, our motto is we are here until cancer is not. And what we are providing and our vision on top of that is like provide the precision radiation medicine. And it is a highly personal and patient-centered therapy, like building on cutting-edge delivery systems that allow precise, accurate, and tailored regimes designed for each patient to optimize and protect healthy tissue. And it is the latest advance of a century-old modality that's a pillar of the cancer care as well. And the increased precision enabled by these systems allows delivery of higher radiation doses in each treatment session while protecting the nearby healthy tissue. And while this can be beneficial to patients and care centers during the routine therapy, and also it has added value in the like the current pandemic environment. And first, the ability to deliver a higher radiation dose in each fraction can reduce the total number of the treatment sessions, which is especially important during the pandemic area when patients are trying to stay safe at home, and also care centers are working to reduce the traffic through their sites. Additionally, as countries begin to relax their pandemic relation restrictions, uh, hypofractioned regimes may help to address the backlog of patients whose radiation therapy treatment sessions were postponed as well. So in both ways, actually, if we are evaluating the current pandemic environment, it's highly critical. And also in terms of like providing such a treatment, we also provide the systems are able to benefit through the integration of complex radiation therapy devices and cutting the edge of the software. And what we are doing is, especially in terms of the preventive maintenance, is also highly important because ensuring that these devices and their software systems are operating correctly is to deliver safe and effective therapy and realizing the full potential of precision radiation medicine. And for that one, for example, what we are working on is like the safe and effective delivery of cutting edge precision radiation therapy requires intricate coordination and support across the globe in the treatment suite as well. And this is because many precision radiation delivery systems are some far from the cancer centers in which they are used. And what we are providing as Electa is like a AI-based predictive solution for our machines. And even any problem has been occurred, is like we are using the automated systems and AI to remotely monitor radiation delivery device performance, predict device failure, and resolve device issue remotely when possible. And the ability to predict maintenance needs and failures opens the door to working proactively with customers and suppliers to address like these device failures. And this we are using some AI algorithms on top of working this and uh, provide this preventive maintenance to our customers.
Thanks, Sushma. And Karan, if I may come back to you, just to take the point ahead, uh, like a healthier world with, you know, more precise care. I think precision is one clear, benefit or focus I can see as a common underlying theme between two otherwise very different kind of organizations. Uh, but tell me a little bit, going into your own organization, your laboratories, your, thinking rooms. How do you envision and drive these, processes to create these advancements in terms of research and design of equipment to deliver this kind of you know reasonably a good delta difference, so that when somebody like Dr. Pradeep or Dr. Jaganmohan Reddy finally uses the equipment on people like me, how do you envision this? Tell me the thinking, research to design to testing, to just take us through that as it happens in your different offices in G, and the kind of people engaged and involved in these kind of works.
Sure. Thanks for that opportunity, Sriram. So, Sriram, any product development in GE or even commercialization or any initiative that we think always begins with the customer, the specific customer segment that we are looking at targeting, and very specific outcomes that that particular customer would be looking at when they buy the device. When Dr. Panigrahi gets up in the morning or Mr. Sobraju gets up in the morning, they're not necessarily excited about this is the new MRI I'm going to buy, this is the CT I'm going to buy. Right? While technology is great, but they are focused on the outcome, right? They want to make a difference in the lives of millions of people in terms of better quality, but also looking at wider access being provided, and at the same time also looking out at sustainable from a cost and ROI point of view. And that's how our customers think. So anything that we develop has to represent the customer's priorities and outcomes. So broadly, if you look at what we look at very broadly is three things: cost, quality, and access. Quality in terms of the quality of care that this can deliver, this device or the AI solution or a digital solution can deliver. Um, at what cost in terms of not just the initial upfront cost, but the cost over a period of time, including operating costs. And how can it improve the access, which means can it become, especially in places where, today in India, if you were to sell something which has to be used in a remote area, you don't necessarily have very high and well-trained manpower, right? So how do you make sure that the device or the solution is easy to use, intuitive, designed in a way that the purpose and the usage is very clear? So really, for us, it begins with the customer outcomes and begins with these three broad areas, which is cost, quality, and outcome in terms of access.
Taking on the cost right now, again, like to go back to Dr. Ms. Somaraju. So, you spoke about, I mean, people know you now. SLG is quite a name to reckon with. You're also known as somebody who's invested quite a lot of money on technology, as Dr. Pani Drive is also talking about. But whenever I speak to you, and it's happened in the past seminars, also a big focus of mine and most common people, perhaps almost everybody, that while we expect quality, cost is a very big concern. End of the day, the biggest concern in private sector healthcare is cost. One of the two factors, of course, the other being quality of will I get better, will I be safe, etc. So when you start investing these kind of monies on technology, and we can see the benefits, I think Karan will speak about benefits from each of their offerings, and Dr. Jaganmohan Reddy and Dr. Pradeep will speak about the benefits they're actually able to get. How does it impact me, a common patient, in terms of cost, and how do you manage to keep that balance between investing on latest technology, enhancing the quality of care, but at the same time it doesn't very drastically impact the quality of healthcare at the cost of a very high increase in cost?
Thank you, Sridham. Coming to your question on terms of costing, yes, I accept it is the most important for the businessman who is investing that kind of money, and for the people who are getting the treatment done. For them, is also cost is more important. So how do we balance in this? Is a definitely tough question to answer, but looking at the advantage of the patient and the treatment what they are going to get is tremendously very huge. See, for example, when there was not much of technology was there maybe 10 years back, 20 years back. I think from 10 years, last 10 years, the technology had increased a lot. Compared to 20 years back, the treatment process, if you go to a physician, he used to write first one blood test. If that blood test doesn't come in right time, before that, he used to start giving some kind of a treatment. So that treatment might take 1 day, 2 days, or 3 days. So if you are when you are younger, because now we are all in the same age, around 40s. So when we go back to our school days or college days, so first we used to go to a physician, and then he used to write some prescription. We used to use that, and then again the treatment was not comfortable. Again we used to go back. Again we used to go back at least 3-4 times. So by that time, the damage must have been happened a lot. See, for example, if you go to a doctor today, I think it is a good. I think just now I got a thought. We have done the COVID treatment during this pandemic. So I will give you a little live example what our physicians went through and our patients went through. See, when the pandemic had started, there was no proper treatment. There was only, they used to say, take a dolo and take rest, eat good food. And then later stage, after 15 days, 20 days, 1 month after the pandemic started, we started getting this tremendous treatment remedies and all. So the treatment process had become much faster, much easier, and recovery rate is also much higher compared to the time when the pandemic started. So similarly, this is also, it is subject of the right treatment at the right. If the doctor gets a right report, how he can get the treatment, the sooner the patient will get recovered. See, for example, we have invested good quantity of money in terms of getting a right technology. Similarly, after the right technology, once the doctor treatment starts, the recovery rate also is very high. So these keyhole surgeries, where there is a lot of less blood outcome will be there. So the patient recovery is also very fast. See, for example, earlier days, if you talk about ortho, if you talk about cardiology, if you talk about a general surgery, or a person goes through a oncology surgery, the recovery rate, they used to stay in the hospital for 1 week to 10 days to 15 days. Now, if the ortho surgery happened, the next morning he starts walking. And within 2 days, he's out of hospital. The main reason is the technology. The treatment was also identified. The doctor had also given the right treatment at the right time, and recovery is also much faster. So this is the reason. Obviously, there will be little cost will be there. There is no doubt. But see, for example, a person who got some kind of treatment need to be done in a month before, he's recovering in 15 days and going back to work, and he's making that money back. So patients are also encouraging. See, if I go through this keyhole surgery, I'll go back to my office within less than a week's time. If I go through a regular surgery, I might need to spend 1 month in the hospital, or 15 days in the hospital, and go back to the house and take other 15 days, and then again I have to go back to the work. So whatever amount of quantum I lost, that is recovering much faster, and faster recovery is also there. See, for example, if we go through a regular pediatric test, one of my friend went through a regular. He was normal, perfectly fine. He went for some regular routine test. He got some liver problem. So he has to go through a liver transplantation. In that kind of stage he was. So he went through a surgery, which is a robotic surgery he went through, and he was recovered in 15 days. And after 15 days, he was in the hospital. He was there for 15 days. After that, he was there for 15 days at home. And within a transplant, a person has gone back to work within a month. It's all thanks to the technology, thanks to the doctors who are using that. So because of these kind of lot of advantages are there, so we invested good quantity in terms of treatment also, in terms of diagnostic also, in terms of treatment also, in terms of recovery also. So this is the major advantage.
This becomes a challenge for people like Mr. Ramakant because people will not be able to compare the cost they pay today and visualize an alternative 20 years ago and say, because 20 years ago the inflation was very low. So it's very difficult to compare. I would rather compare at absolute cost levels today. And that's the challenge really, to communicate how technology and better processes are actually. But the bill, that big bill that comes, that's what it you. I had a question for you, Dr. Pradeep, but I'd like to just go back to our two tech industry specialists, Mave and Karan. What kind of pressure is there on you from hospitals, from doctors, from your customers on cost, only on the cost? Uh, how big a factor is it for the hospitals and you know uh, owners and managements of healthcare institutions to deciding? And are you conscious of the eventual cost impact on the customer while designing these technologies?
Sure. I can take that. So as I said, as I was mentioning, that the three big factors, right? Cost is definitely an important factor in that, and it's always a trade-off. But also, we've got to always constantly look at how can we optimize cost on behalf of our customers. So it's not just something that our customers pressure upon us. We pressure upon our own system, and we build processes to make sure that we're only putting in cost where it's creating 2x, 3x, 5x value for the customer. And I think Mr. Somraju made a great articulation around what is cost truly, Sriram. So while the upfront dollar payment of a machine or a tool or a device that you're buying is cost, the cost of using it over a period of time. For example, if I have devised a better technology which uses less consumables, which is, for example, a PET CT, or if I have devised a machine which gives great image quality at a much lower dosage to the patient, which means less harm done while you're still getting diagnostic quality. Or if I've devised a machine which consumes less electricity over a period of time, right? All of those help you recover your cost over a period of time. So while it's cost, it's not just the upfront cost, it's total cost of operating and the cost of delivering the outcome, which I think Mr. Somraju very nicely captured. But just in terms of the dollar also, we are very conscious. For example, in India, we've launched Made in India CT and a Made in India PET CT. And both of them have been great success. In fact, the usage of CT in India, the entry-level CT has gone up tremendously from the time that we've launched this about 4 or 5 years back. Today, more than half of the CTs are GE CTs. And this new one that we launched, we've crossed more than 1,500 CTs. People who did not think of buying a new CT would typically buy a refurb or not buy for a long time, are today investing seating as a technology because we've lowered the cost from typically $500,000 to about 200 or 250K dollars, right? So that is something we are doing with PET CT similarly. Today, the oncology care, which is being provided in India, has really changed a lot compared to 10 years back. You even a multi-speciality would not think of providing oncology in their hospital 10 years back. Today, you have single specialty oncology providers making money with a good ROI, good operating margin. And one of the things that we've contributed is by creating a lower cost, PET CT, which by the way scales up as you scale. So for example, we looked at an innovative design where the detector itself had only 2 rings to start with, because when you start a center, your volumes are low. As your volumes go up, you can add a ring at the center without having to ship it anywhere. So it has an upgradable part. You keep adding the ring and incur that cost only later on when your volumes are going up. So we are very, very conscious, and there are multiple ways that we look at it.
Thank you. Dr. Pradeep, now the question comes fine. There is this beautiful technology that's ready available in the market. Karans and Mavs of the world will bring it to your doorstep. Entrepreneurs and visionaries like Dr. Somraju would take the call and invest and bring in the technology. But it's finally going to be in your hands, the hands of
Yeah.
doctors like you. So give me a sense of two aspects. One is this area of the use of technology in healthcare, is there any regulation to it? Is there any sense of rules to it? Or can a hospital and doctor start implementing any technology? That is one. Because on the other hand, when the drugs you prescribe, they go through so much of testing and approvals. But what about these technologies? If they are going to become such a significant part of the care ecosystem of cure, of surgery, of diagnostics, etc. Is there any sense of some institutional oversight on that, or is it like a free for all kind of a context there? And more specifically, tell me from the we welcome Dr. Jagan Mohan Reddy. By the way, he's just finished the surgery and joined us. Thank you, doctor. I hope the surgery was successful.
Yes, yes, sir.
So, Dr. Pradeep, take us through in that sense.
Sure.
Give me a possible specific example to us on how the technology has helped you as a doctor in giving better care. So, giving us a sense of the regulation to this whole area and to actual benefits that you have experienced as a doctor, as a practitioner, and the benefit to the eventual patient.
See, as healthcare scenario, we have it's a multidisciplinary, multifaceted involvement. See, it involves the patient's, as I told you, social status, economical status, and everything. And for a country like us, where we have to, as you have just raised the issues, cost to cost. For a country like us, when healthcare is concerned, forget about healthcare, anything is concerned, we need to have regulatory bodies. And similarly, the government of India has multifaceted and multi-pronged regulatory bodies are in place. Like if you go back, as the healthcare is concerned, it's mainly under the control of Department of Health and Family Welfare in association with Medical Council and ICMR and other research bodies, which actually justify the need and applicability of the new technologies. So we started going back to 1983 when we first had a National Health Policy, NHP, and it went through multiple cycles of changes depending upon the demands and suggestions from technologists, doctors, and various experts, including scientists. So regulations is a must for implementations of any newer things. Finally, it is the accountability. Finally, it is the responsibility. And finally, what matters is not machine, but it is a life. So when life matters in healthcare, we need to have a regulations. Like Western world, they also are still struggling when they're coming back to artificial intelligence, AI, artificial intelligence. The reason is it has got a lot of, as I told you in the beginning, it's a lot of pros as well as cons. So when it comes to pros is fine. When it comes to cons, as far as responsible concern, doctors when he does it, take a decision. He is accountable to it. He is penalizable for it. He is takes the responsibility, onus of responsibility. Anything goes wrong, it is his negligence, and he is penalized. When it comes to machine, though it is handled by the physician or the doctor, but still we need to have articulations of multiple data. So machine is just fed because of robust data fed into it. From time to time, there should be a process of changing it to update it. Otherwise, the machines can predict what was given to it some years back pertaining to some disease. Take an example. If I feed AI for diagnosing tuberculosis in the machine, so time and again, whenever I try to do further test, it try to lean towards same tuberculosis. The features and everything will showing toward tuberculosis. So there may be chances of going errors or erratic. So this is where we need to have updations of policies or the policies and updatation data, where we have to keep on updating our policies, keep on updating the data into it. So just like titration of machines, we have to keep on titrating the AI as well. So that is where we'll get a better outcome and precision. As far as even the Western world, as I told you, they also have been, so almost more than 20 countries have participated since 1917 for formulating a lot of regulatory bodies, but none have achieved to a conclusive regulations as far use of AI is concerned. China, of course, has stipulated its time frame. Like if by 2020, it want to do is almost in every field, including healthcare. By 2025, we want to come back with some premium ones, and by 2030, we want to make it as if they are the world leaders. So, based on that, we also have a task force. Government of India has formed a task force of technologists, of scientists, of doctors, of bureaucrats, and all that. So, task force in association with the NHNPA, or sorry, NHA, National Health Policy, NHP, I'm sorry, is formulating on that. So rule regulations is a must to have a catch on it. As far as costing, as you said, sir, anything comes at the cost of something, but we have to understand one more thing. So the duration, short-term cost may be high, but when you compare to the duration cuts us. So we look for the long distance, but we don't look at the shorter form. When it comes to shorter format, when the patient stays short, obviously the bill amount is nearly the same than staying for almost 10 to 15 days, as my AD, Dr. Samraju, has already forecasted earlier. In earlier surgeries, patients to stay for 10 days, 15 days, and so on. Now, precisely when you come back to your onco, like Umar, agree with me, like the precisions, what these machines are doing right now, it is leading as compared to suppose you go back to a cancer therapy or cancer treatment. We need to diagnose the cancer, we need to go for multimodal, MRI, this, that. Then subsequently, we go for a tissue biopsy. Tissue biopsy is still painful. Tissue biopsy is again, it may be inconclusive. But artificial intelligence had added so precisions. It has led to such micropixel level that where even the machines are able to diagnose that very, very specifically that malignancy. So we didn't have to go for a biopsy. We didn't have to go for a nodal biopsy, or we didn't have to go for an FNAC. We can direct straightforward go for the treatment. So this makes a sense. On the contrary, if the data what is being fed to the AI is not leading in the right directions, there is chance of going errors or erratic. So here the man comes, as I told you in the beginning, it is the man behind the machine. So here the man comes where he has to use his own brain and his knowledge precisely to arrive at a conclusion, and rather than just incidentally going on depending upon the machine.
So I'd like to go to Mary first and then come Ms. Somraju. Uh, I see a high level of conversation from the doctor here, and I'm sure when we bring in Dr. Jagan Mohan Reddy, he will speak. So they're highly uh, comfortable with very cutting edge technology in terms of what's happening. So, what kind of learning training curve? Because firstly, one of the reasons I respect doctors so much is how many years of their life they put to study. I mean, they study more than anybody else does. By the time you become like a good doctor, a cricketer retires. So, you know, that's the kind of stuff. And then you have to expect them to, besides keeping up with medical knowledge, also keep up with developments in hardware, software usage, AI. So, what kind of training effort comes from companies like yours, and how much has it impacted? Because I also realize, Ms. Somraju, the time of doctors is very precious. I mean, there's so much time you can keep throwing them into classrooms each month as new technology comes in. So, can we have Mary speaking about the training curve of technology adoption, and then go to Mr. Samaraju.
Yeah, coming to the training part, whenever this new machinery, new technology comes, the companies will generally provide them a lot of training. And number one, they'll do a lot of training, and actually all these practices, when they do a regular practice, the more they do, the more the technology they can use much faster, because they every year they have at least 45 to 50 days of conferencing they go and attend every year. Maybe sometimes 3-4 times a year the big conferences happens. They go attend, they learn the technology, they exchange the technology, and the industries, the companies who provides the machineries and all, like GE and Electra, they also give a lot of training to them, so they also can sell their products to the entrepreneurs like us through them. So a lot of training and has been obviously the given, and it is definitely a person who is using a 1.5 Tesla that can be easily adopted to the 3 Tesla. So when the technology is more, the doctors are also more interested, because they also can give better treatment and they also get beautiful name in the market. So the success rate is also very high when they use the more technology compared to that is the reason the person who goes get the treatment done in a village from a RMP doctor than coming to a metro city and getting the treatment done. Where? Because he gets more advanced treatment, more experienced doctors, more experienced facilities are provided. So this is the advantage.
So I'd like to bring in Dr. Jaganmohan Reddy here. Dr. Jaganmohan Reddy.
Yes, I'm here, sir.
Dr. Reddy, all the conversation we've had so far has been fantastic. I mean, technology is great. Yes, there is a cost, but it eventually gives great benefit to the end patient. But as I brought in at the start, that in everything in healthcare, whatever benefit may go to the end consumer, that's the patient and the families in the end, it has to be routed through you, people like you, the specialists, the doctors, the surgeons. Tell me, in your own understanding as a doctor, you have your own judgment. You know, you're, for example, an orthopedic, a super specialist. So obviously you practiced before the advent of this kind of technology. You are adopting new technology. How is your relationship with your practice, with your discipline changing and evolving as you adopt new technology? Do you find, especially your juniors, becoming more reliant on technology? Is it necessarily always and completely a good thing? To what extent should a doctor rely on a machine, on data, on diagnostics? And at what level, the clinical side or even the intuitive side play up? At least from that perspective of medicine as a science versus medicine as an art, as a human thing, or as that some gift of gods that you have, which we can perhaps not understand, only benefit from. Could you speak about this challenge, this balance? And
Yeah, hi. Thank you for giving this opportunity. It was a nice question. And this man and mission and role of artificial intelligence in the medical healthcare. As I have seen before the invention of the modern technology, and I'm using the modern technology now, I've seen a lot of change in the medical practice. When I was a medical student, the MRI was rarely available. MRI was available only in the top premier centers. It was not available at the districts or for the common people. Most of the physicians or surgeons at that time, they used to depend mainly on their clinical skills. For example, a cardiologist, he will listen with his own stethoscope and he will find out what type of murmur, what type of valvular disease, how much is the ejection fracture and other things. He needs to diagnose by just seeing the patient, by just auscultating the patient. Whereas as the technology is going up, the juniors are not getting that type of training. They are not exposing that type of training because as the generation is every 5 years, the new generation is coming up. They are not teaching in that manner, not in that traditional manner. So the one is lack of training. Two is more dependence on the investigations. For example, echo. Echo is there. Uh, Before they used to diagnose only by the clinical judgment, but he used to tell that this LV dysfunction probably around 70%, 80%. But in the modern sector, the trainers, the trainees, both are more dependent upon the new technology. There is an advantage is that is subjective evidence, and this is a objective evidence. And as you know that most of the medical is going towards the medical legal things. Their patients are challenging the doctors. They are going to different doctors for their opinions. Suppose if you give one opinion, they will go to other doctor and they will take another second opinion, third opinion. But you need a strong evidence. Even the law believes that the objective evidence is good than the subjective evidence. Suppose if the patient comes to me with a knee injury, if I examine, if I tell that he got that particular ligament injury or a meniscal injury, because of my clinical experience and judgment and clinical evaluation, I can say that. But the objective, the court or anything believes only the objective evidence. Therefore, if you go for an MRI diagnosis, you will get it. So the technology has changed and it is useful to diagnosis quickly, from diagnosis, accurate diagnosis, and better treatment can be given to this. The technology has an integrated part of the medicine now. Even from the first year onwards, the medical student is reading the MR scan, how to read the MR scan, how to do a CAT scan, how to do an echocardiogram. So the technology has mingled with the medical field, and it is useful and it is a positive thing also. In other words, you can't totally depend upon the technology only. For example, in on orthopedics, when I do a surgery, we will depend upon the machines like robotic surgeries or navigation surgeries. They may not, one should know that how to operate that machine, how it works. It works from machine learning. If you give a constant feeding, they will give these directions. The advantage is there and the disadvantage is there. Very advantage is reproducibility. Suppose if I do any knee replacement or hip replacement, need a precision cut with a naked eye, with a naked hand, it is difficult to do that precision cuts. With the difficult to do that 2 degree, 3 degree angle or 2 millimeter, 1 millimeter, it's very difficult to judge it. Whereas if you give it to robotics, if you give it to that machine will guide us to give a precision cut, to give an accurate cut. That helps in better outcomes of your surgery. In other words, it may give a wrong judgment also, it may give a wrong cuts also. So the surgeon should understand when to stop, when to believe that machine or not. So it is a double-edged weapon, whether to completely depend upon the machine or not. So it is a judgment. You have to balance it between the machine and the surgeon capability. Mix it. If you use it, you will get a wonderful results for the better outcome of the patient.
Dr. Somaraju, I mean, Ms. Somaraju, I'd like to ask you, sorry, I'll keep making a doctor. I'm also not a doctor, but there's something about your name that I just don't feel like saying Mr. The doctor comes out. But tell me this, I'm asking a question beyond the specifics of your role, obviously. It's great for advanced hospitals like SLG and other big names to invest in these kind of technologies. But what I've understood from what Dr. Pradeep and Dr. Jagannath Reddy were saying, if therefore government hospitals and hospitals in smaller towns and villages do not invest, and they perhaps cannot invest on these kind of technologies, are we not ending up creating, and you're not responsible for it, but just help me understand, two different layers of healthcare systems, where the healthcare availability in a small town or village will actually be 20 years behind, will be far more riskier. The duration of the cure, the surgery, the recovery will be higher, and ironically will be more expensive. In other words, if technology is becoming so significant to healthcare, is there a risk? And do you see in your interactions with our bureaucrats, with the government, the value of not just building hospitals, but investing on these kind of technologies?
So coming to that, actually, uh, there is a less investment is done in the villages and districts. Definitely, I accept that. But thanks to the government now, through the medical colleges, all these investments are going everywhere. And Medical Council of India also have certain specifications to get a medical college accreditation. So they also have to invest on this higher end equipments, not maybe this level of higher end equipments, at least 50-60% of higher end equipments, they also have to invest, number one. Number two, they also have to give training to the students, the medical students, the new younger generation doctors. They also have to come, because it is all it is all reputation of the hospital, of the medical college where the student, where the doctor is coming out. So they are also investing, and government is also investing. Government also have every area they are coming up with the medical colleges and 500 beds, 1,000 beds hospitals. So which is accredited to the medical colleges, so government medical colleges and private medical colleges, and definitely there will be, and maybe today we might not see the result. Maybe 5 years down the line or 10 years down the line, we definitely see the results, and the students who are coming out of those colleges will definitely compete with Dr. Jagan and Dr. Panigra and all.
So I'll like to take this now to the two healthcare providers, Electa and GE, Karan and Mav. If you could, beginning with Ms. Mav perhaps, and then coming to Mr. Karan, what kind of focus in terms of sales and engagement do you have with government hospitals, small town hospitals? Do you see some start of some traction there, or are we really leading a whole set of healthcare players far behind by virtue simply that they do not have the wherewithal to invest in technologies like yours? Just give us a sense. Mav first.
Yeah, well, actually, in terms of such technologies, we don't differentiate according to the like a public, private, or small size or big size. So whenever who needs those technology, we are volunteer to provide it. But the importance is actually to identify the current needs, and because in AI there are lots of varieties and lots of areas to improve, the most important part is to find the focus area and create this clinical outcome for all the community.
Thank you. Karan?
Yeah. So Sriram, in the last about 4 years, 4.5, 5 years, our own revenue to the government segment has more than doubled. And so, I agree with Mr. Somraju and the panel here that I think the government is doing a good job of investing in specific areas, sectors where infrastructure upgradation is required. I think they've done a good job in terms of COVID response as well, setting up a lot of capacity, both by themselves and working with the private sector to be able to do that. So I think the role of the government is twofold as we see it. One is being the payer, being the direct provider as well. So there, as I said, we see doubling of capacity, our own revenue, and I'm sure that's something which is common, everyone sees it. The other thing is providing the right regulation, whether it's direct or indirect regulation. For example, AI, now that we're talking of, or even amid COVID, the response for telemedicine and teleradiology kind of regulation. Very quickly, within March, if I remember correctly, a regulation for telemedicine came out because that was the need of the hour, which has been pending for years, by the way. People have been thinking to do, not to do. So I think the government has to be both the buyer, which they are, that's on the increase. It's not adequate. We are a 1.3 billion people, but it's on the rise. And they are, I think, coming up with great regulations, policies, even the NDH and the National Digital Health Mission, which is being executed by NHA. that is going to be a game changer and a huge, it's a very ambitious program, but it's going to be a game changer in terms of bringing in digitization, virtualization, and ultimately, bringing in the AI applications, not just for the public, but the private sector. So I think definitely I see a positive trend.
I'd like to ask both of you a supplementary question for both of you. Uh, do companies like yours have dual policy in terms of pricing? Do you sell at a more expensive rate to the corporate client and maybe at a lesser price to the government hospitals? One. Second, data is very important. Machine learning and AI need data. So when you engage with public health, you're talking of huge numbers of people. That data will make you more efficient. Is there a way you would acknowledge that as a value coming in substantiating the policy of dual pricing?
So no, Sriram, there is no duality in terms of pricing so far as GE Healthcare is concerned. The price is for a technology, for a deployment. There can be differences because of the configuration, as we call it, right? So even a CT or an MR will have hundreds of different elements for pricing each of them: hardware, software, deployment, all of that. So there is no, if like to like configuration, there would be no differentiation, absolutely. Um, I think to your second point in terms of data, GE Healthcare, while our equipment obviously process and create a large amount of data, but we are not the owners of any of that data. That data is owned by our customers, like SLG, and ultimately, that data is also owned by the patients. So, in fact, the NDHM document, the government has also come out with a policy on, who owns the data, because they are looking at, processing a large amount of data and making it in an anonymized form available to startups for creating AI, right? So clearly, the ownership lies not with the device companies, but with the facilities, the healthcare providers, and with the patient.
Maybe.
Yeah, well, actually, it's like for in terms of Electa, we don't have dual pricing. The pricing is like a function of the system configuration. And for example, for the data, what we are using is we are using IntelliMax, our system, to predict the downtime of the machines. So we are analyzing the data, and according to IntelliMax algorithm, we estimate the possibility of the downtime of the machines. And like as you said, yes, we are for the data, capturing the data is highly important. But the critical item in here is, as companies, we are all aligned with the data privacy rules as well. So as mentioned, the data is owned by the hospitals. What we are doing is we are providing the technology that they can use their data more accurately with the help of the AI.
I'd like to go to Dr. Jaganmohan Reddy. Tell me two things, sir. Within medicine or different branches, disciplines, is there a difference in terms of technology being more useful to some areas, like say oncology or cardiology benefits more, but maybe dermatology or dentistry doesn't really benefit so much from these kind of advanced technologies? That is, so in other words, is this technology able to benefit and impact different disciplines of medicine differently? So which are the areas where the technology adoption is the highest, where the services offered today is absolutely the most advanced, where it will take the longest time before it's adopted? And to tell me this, once you bring in the technology in your hospital, what kind of a change you need to bring to your protocols, your medical processes, your quality standards at the level of the preparation of the surgery room or post surgery? I mean, how much does it impact in terms of your own processes, your methodologies of work, etc.?
Yes, it's a very good question. One thing is In the medicine, each and every branch, every faculty, or every subspecialty of the medicine are using the modern machines, and they are depending upon the artificial intelligence and modern technology. But certain branches, like a neurosurgery, where you require more precision. Suppose if you are operating on the brain surgery, you have very small error is acceptable. Even if you cut 1 millimeter more, you will get paralyzed of the particular part. Suppose there's a brain tumor is there inside the brain cerebrum. If you remove the extra part which is not required, then that hand may be paralyzed, the foot may be paralyzed, or the leg may be paralyzed, or the foot organ cannot work. So in that areas, you required a precision. Or for example, oncosurgery, surgical oncology, you want to remove the tumor. So if you have a new technology like on-table biopsy, also called cryobiopsy, cryo things, if you take a sample and you will see under the microscope then and there only, whether it is a normal tissue or a tumor tissue, that means that is a technology. You can use the laser knife to cut the precision cuts. So suppose if you take more, you are damaging the tissues and you are giving more morbidity to the patient. Suppose if you take the less tissue, you are leaving the tumor tissue there. There is a chance of recurrence. In that situations, you definitely require more precision instruments, more precision equipment is required. For example, robotic surgery, robotic laser excision of the tumor, robotic laser removal of the damaged part. So areas like neurosurgery, oncosurgery, they required this sort of equipment. And also every specialty is required, even for dermatology. Simple melanoma, melanoma is a skin cancer. So do you want to take the melanoma, well, even though it is a very small thing, but it's a very, very aggressive tumor. If you miss it, you will lose the patient. So in that case also you required the things. So, but the technology is more because the involvement is less in that areas. That's why they are not using. But in my opinion, each and every field required the modern technology, modern equipment. Even for example, pathologist, you need a subspecial pathologist like a neuropathologist, musculoskeletal pathologist, gastrointestinal pathologist. You can't have the specialties all over the place. So you have in one premier center or from premier location, you will have gastrointestinal pathology. If you take a biopsy from the stomach, and if you see, normal pathologist can't diagnose, but you need to have a good trained pathologist, which is not available. But you can depend upon the machine, you can depend upon that. It will guide you, because if you feed the data to the patient, that is called machine learning, the machine will give that this is a thing. This is suspicion of the tumor, the suspicion of the gastric tumor, gastric cancer. So in my opinion, the each and every medical field requires a highly sophisticated equipment. But because of the cost constraints and because of the huge investment can't be done at once, first you need to give a priority to the needy things more, or more volume things more, rather than the small things. That is my opinion.
So I'll ask you one last question now,
Yeah.
and then I'll also be grateful if Dr. Pradeep answers it. It may not be perhaps personally relevant to you, but somebody your junior, somebody who's in medical college doing MBBS second year now, is there a possibility, just a thought, that by the time they come to your level, maybe the currents and nerves of the world will create such machines for Ms. Somaraju that they don't need you at all. The machine can do everything.
It's a very good question.
I'll come to you, Ms. Somaraju, in the end. I don't want you to answer. I want the doctors to talk about this. Job losses in every segment because of technology. I know, like I said, acknowledge at your level, you're very successful doctors, but somebody who's very young, somebody who's in MBBS college right now, and will take many years by the time they will the Gs and electors of the world create the complete artificial doctor, the machine that can do everything. Dr. Reddy and then Dr. Pradeep
Yes.
Pani.
Yeah. First, Dr.
Dr. Jagan, go ahead. Dr. Jagan, go ahead.
Yes, sir. It's a very good question, and it is some young budding surgeons or doctors are fearing that technology may overtake our jobs. We may lose the jobs. They may not need so many doctors to perform the duties, but I don't think it will happen, sir. You can't completely rely on the machines. You can't rely completely on the technology. You need some person, but definitely the less workforce is required. For example, a junior doctors, suppose a ward is managed with that, with the 10 doctors, they can reduce to half. 50% can be reduced. The 50% jobs like routine monitoring of the blood pressure, blood sugar, pulse rate, or when to take the blood sample and other things can be managed by the robotics, can be managed by the machines. But ultimately, we need some workforce is required. As already we have seen a few upcoming doctors, they will do only the laparoscopy. If they can't do the laparoscopy, if required open, they have to call the senior surgeons or those surgeons who can do open surgeries. They can't do open surgeries now because they are trained in only that focused areas. That is the thing. In my opinion, yes, there is a little what you call less workforce is required in future. Probably in 50 years, maybe more depend upon that. But you can't completely eliminate the doctors. It is highly impossible because ultimately you have to check the machines only by the doctors. Suppose if you go by virtual clinic or virtual, if you go for, if you have some heart problems, you go to some robots. Robot will test you. Robot will give a test your blood sugar, your body fat, your BMI, your blood pressure, your height. Everything measures your cholesterol level, your homocysteine level, and it gives a like this. You got this your possibility of left anterior descending block is there. You require this medication. Then robot will give a printout to you. Ultimately, you have to go and double check with the doctor. You can't take directly from that robotic things. That is my opinion. It won't take completely, sir.
Dr. Padigray.
Yeah, Mr. Ram. Just to be precisely, you need someone whom you have to penalize for the negligence. Machine you cannot penalize. So finally, it's the doctor. So it cannot be replaced at any cost. So
I
it,
love
as I
that
told
answer.
you,
I love that answer, Dr.
I, so
Pradeep.
absolutely, sir, absolutely. It's with the lighter side, to be on the lighter side.
Yes.
And as I told you from the beginning, it's always the brain behind the machine. And I told you, it is just an interface. It is just an interface between machine learning and the brain. And it is not an artificial replacement for it. Number one. Number two, see, sir, any time you have accountability, as I've been pointing out from the beginning. So it's just like a black box decision making. So black box decision making by a machine will have definitely some error. Whereas when it a decision making comes to a person individually using the machine's learning, so his attitude is what matters. His attitude of the doctor, as you said from the beginning, you have been asking, what about the training? Or the training part? You asked to so many people. So I will say the only one answer. Actually, it is the attitude what makes sense. The attitude of the person is attitude of the physician who want to implement it. The way he want to learn, so it's the way he learns. And this black box, as I told you, interpretations. So what happens is there is no scope. As I from the beginning I said, if it is a machine, a tool, the AI has got some chance to correct because anyway, it's not going to damage or harm it. When it comes to life, we cannot make a hit and trial methods. We cannot make a trial and error methods. We have to be very precise. So, in the distance learn or short learn, there is no replacement to the gentleman called doctor physician. Okay, sir. So that will be the part we have to bear with it. Yeah.
So, Karan, come on, tell us the secret. 10 years down the line, how advanced will the most advanced product or service you will be selling to people like Mr. Somaraju? And to
In
what
the
extent
next
you
10
won't
years,
need Dr. Pradeep and Dr. Jagat? Tell me, come on. Give out the secret.
in the next 10 years or even 20 years vision that we would have, there is no replacement for a clinician, a doctor, a radiologist. I'll And I'll give you a technology answer. I think what Dr. Pradeep said is absolutely right. I'll give you the other side of it. There are three kinds of AI. There is something called as a narrow AI. Some people also call it as a weak AI. Then there's something as a strong AI. And then you have what is called a super intelligence, what you initially mentioned, right? Super intelligence, there's a debate whether it can ever happen. So I won't even talk about that. But between a weak AI and a strong AI, a weak AI means that you are able to give one specific goal to the digital tool and ask the digital tool to learn. And that learning, by the way, Sriram, happens. That learning is nothing but an aggregation of all the expertise of the radiologist for that one pathology. So imagine I'm creating one app for one pathology in X-ray. Now, X-ray itself is 25, 26 different categories. And within that, there can be 150 different possible interpretations plus of one X-ray image. And AI can pick up one or two of those. A radiologist will pick up 125, 150 for an X-ray, and then he does the same for CT or an MR, right? So the scope of narrow AI is very, very specific. It is like saying, because the Excel sheet is invented, you don't need the accountant, right? The Excel sheet will do the math right and enable the accountant to do an even better job, right? So you can't throw out the accountant. It's the same thing with these tools. The whole idea is to improve the efficiency, effectiveness of the radiologist or the doctor, to be able to provide them stuff ready to consume and take a decision quickly, but the decision will be theirs, the diagnosis will be theirs. This is an enabler, which then helps them improve their productivity. So today in India, you have 10,000 radiologists. Clearly not enough for everything that we want to do for 1.3 billion people, right? Now imagine if the productivity of each radiologist goes from being able to report for 50 exams to be able to report for 150. That's effectively 30,000 radiologists that you've created. I think that's the power of AI that we want to utilize and that we visualize.
So, Ms. Somaraju, a quick word. At what point of time will you have more technology, less doctor? Where is the outer limit?
No, there is no way without a doctor a patient can be saved, a treatment can be done. As Dr. Jagan said, and actually Dr. Panigraha said, there might be a little reduce, but looking at the Indian population and all over the world population, the way it is growing, the population, the way it is growing, the doctor is required, the patient treatment is required, the technology is required, the diagnostic technology is also required, the treatment technology is also required, and the doctor is also required. Without a doctor, nothing can be done. And as Dr. Panigraha said, without a man, the machine also cannot work. See, I think there is little confusion in terms of robotic surgeries, which people are talking about. Robotic surgery is also performed by a doctor. Robot will not do a surgery. Robot is an emission which is being named as a robot, but it doesn't do any surgery. It is surgery is done by the doctor by using the robotic technology. That's what some confusion I think a lot of people might be having. So this is from my side.
So essentially it is robotics aided surgery, AI aided surgery, AI and robotics aided practice of medicine, and not really doctor versus machine, but doctor and machine working with greater efficiency, greater precision to achieve the most fundamental desires of all human beings to have a healthier life, a longer life, to prevent disease, and if it can't be prevented, cured at the easiest and the lowest cost, of course, socially, but also in the fastest time, and obviously make our lives longer, happier, healthier. Uh, at this point of time, it's only fair, no matter how much of technology we speak about, the final word has to be with the doctors. So my absolute final question for the two doctors, and after that, Priya will take us through the interactive session where all of you are watching us for over 80, 90 minutes. We never sensed it thanks to these exceptional speakers. So I thank each one of you. I thank, of course, all the organizers for this opportunity to interact with you, listen to you. So I'll ask the two doctors this. When people are not well and they come to a doctor, they look for cure, of course. They look for the objective, the science. But there's also this pain and fear, and human beings, their minds, their hearts, they become like infants, like become little children, no matter what their age, what their social stature or intellectual caliber otherwise. How will you in these days and in coming days balance this high tech oriented solution to the patient with a human touch, which is still the most important? Nothing makes a human being feel so calm and good as when just the doctor puts a stethoscope and says, you'll be better. So how do you combine high tech with that kind of a high human touch? And what advice would you give to both the companies making these technologies as well as junior doctors on how, while they increase their understanding of technology, how do they retain and focus on that empathy, that human side?
Yeah, Mr. Ram, as you said, there is no alternate to the compassionate touch a doctor gives to his patient. That interaction has no replacement by any means. So it has to be there that if I just touch a compassionate touch on the patient's body, that itself gives the body language that I'm there to care for you. You don't have to worry, I'm there. This message is from time immemorial and it will continue for days to come. So here there is no alternate to this. Yes, technology has hastened or made the diagnosis process precision, speed, and decision-making process have become faster, including like bedside. Yeah, the use of AI, like that Siri and Alexa and all the similar type of platforms will come, where bedside learning will be easier. We can just at the side of the patient, we can make a decision precisely and at a very fast moment. So we are able to deliver the treatment faster rather than going back to my office, connecting to the lab, connecting to the diagnostic center and making a decision. So I'll be able to make the decision on the bedside. And since see, it happens when we have lot of volumes of patients, volumes of loads. We don't have time even to go from one bed to the other and go back and take a decision on the first bed. So we have to make it precisely then and there. That is what Karan and team are going to support us with the technologies that what we are willing for and what we are looking for. And now can Jagan, you can just, Jagan, I think he's out of.
So I'll end this, hand it over to Priya, but before that, I'll give you two ideas, Karan, from perspective of technologies you can develop for doctors. Can you make some technology by which the handwriting of doctors can improve so that everybody can read what they write in the prescription without having to?
Mr. Sriram, touch wood, I have practiced in such a way my handwriting is well readable.
So that'll be wonderful to have a technology by which
thank you absolutely lighter side, yeah,
handwriting of the doctor. And second, Karan, while technology in real hospitals improves so much, our movies where they show surgeries is still horrible. Can't you, GE, make some replica and give these movie producers some advanced looking technology? They put ovens instead of or geysers and ovens, and to store heart and liver. So you should have a department, a branch where you sell proper replicas of your machines to be put in our movies. Our movies, surgery rooms are still very obsolete. With just a little fun for a thought. Thank you everybody for this wonderful session. I hand it back to Priya.
Thank you, Sriram, and thank you, gentlemen and Merve, for that very, very I must say, deeply insightful enunciation. You brought home the fact that there are algorithms, machine learning, data automation, but all these have opened up the paths to, the pathways to excellence, but they're just tools of execution. They can never replace what an experienced surgeon or physician brings to the table. Who would ever choose to have a robot's assurance over a doctor's hand patting the patient in reassurance? I think the healthcare experience at its core values humanity the most, and that's the way it's meant to be. So, thank you all for doing what you do. We have a few questions in a chat box, so let's make the most of them. I have written them down because the font was very small on YouTube. The first one is from Dheeraj Sharma. He says, can you give us more examples apart from onco and diagnostics? Any role in out of hospital care for chronic illnesses and monitoring in critical care or OBGYN? So any role for AI in any of these specific areas? That's what he's asking. So I think Dr. Pradeep, you should be able to take it because
Sure,
Dr.
sure. I'm just taking the call. And as far as this question is concerned, okay, we have been talking about robotic surgeries, pathological diagnosis, radio diagnosis, imaging, and all that. We are forgetting about the subject like what we discussed right now, dermatology, like the subject like psychiatry, like everything. See, let me tell you, intensive care is one of the critical area where AI is going to just give metamorphosis. See, right now, many places we don't have skilled manpower to manage ICU. We can have remote ICUs. We can have remote ICUs where, again, the robust feeding of data, robust feeding of collected data from reliable sources and processed can be able to make can help the doctor over there to make a precise decision in patient care. And next, coming to cases like chronic ailments of neurological origin, where patient sometimes loses speech, patient sometimes loses motor activities, patient sometimes loses even the cognitive power. So in that scenarios, AI will definitely in the future will have a role where it can replace back few of the functions, if not all, of the patients. And similarly, even we are using AI for de novo surgeries, in utero surgeries, when we have able to detect in vitro or inside the uterus the deformities in a child before the child is born, where the fetus is born. So AI can augment the process where we'll be able to precisely handle those defects and rectify it. Uh, I can leave it to Karan if you can just add to it.
Sure. So imagine a world as an example. I think there are three key forces, as Dr. Pradeep said, which will create delivery of care anywhere, anytime. So number one is digitization, which means the processes of a hospital or the delivery that they're doing or the input is available in a digital form. That's one force, which is already happening. Number two is virtual delivery of care, which means, and COVID and all of this is really forcing us to look more and more as to what all that we typically deliver on premise in a hospital can be delivered virtually to a patient without they having to come over. So, right? So that's the second force. And the third thing which will join along with this is artificial intelligence. So imagine if you put all these three together, you have an application, you have a problem, you log in, you are able to using AI, on that application, you're able to understand from the patient's voice, from the what the patient is describing, the questions and answers. You are able to have a preliminary 60 to 80% accuracy diagnosis even before a doctor comes in. Imagine now if he's already done some tests, including diagnostic images and lab tests. And all of that is also available on this platform. Even before the doctor starts seeing the patient, all of this information with the AI layer is available in a form that the doctor can consume and he's not yet asked the first question to the patient. That's the power that is happening today in their platforms, and it will only continue to evolve. So I see virtual care, digitization, and AI taking the hospital to the patient, besides the patient coming to the hospital.
Thank you so much. Yes, that was so amazing that AI will help you, with giving you so much information even before you actually go to the patient. So that's really good. The next question is from Manmohan Singh, and he is asking, is there any program being run by the Indian government to bring this advanced technology to local Indian medical device manufacturers? As in, are they looking at technology transfer? So I think Mr. Somaraju should be able to throw some light on this.
So I think for this, thanks to the state government and the central government by starting this Make in India programs, where a lot of new talent from, if you talk about Telangana, we have a T hub here, where a lot of talent people goes there, do their research, and where the government is providing them the basic infrastructure, then the investor also they are coming, they are having interaction. If the thing is successful, yes, they are doing the investment and going ahead. And I think government is doing that in a correct manner by taking this Make in India program, and from Telangana, the T hubs, they're doing a fantastic job in that. I think new talent with lesser cost are coming, and the benefits also will be passed to the patients, not very far, very soon.
Thank you. That's reassuring.
Priya, I just want to quickly add 10 seconds to that.
Yes.
And Mr. Somaraju and the team, SLG's team is aware. GE Healthcare in India is actually Wipro GE Healthcare. And we see ourselves as an Indian company that makes a lot of stuff in India and exports outside. And we happen to have a MNC parent outside of India. And I know a lot of other counterparts and companies are looking at it. So I think the making in India is happening today already in a big way, and will only continue to.
Thank you. Thank you, Karan. Arijit Das wants to know, what is the role of MBA in healthcare management in an AI-driven world?
So I think I should take that.
Yes.
Yes. So it is the subject. It is the subject where the balance between the doctor and the patient has to be done by this program, these students only. So MBA in hospital management or anything, these are the balance between the patient and the doctor. Doctor will not be in a position to explain in terms of other facilities, other services like housekeeping services, like front office services, like communications. All these will be handled by them. So there is definitely a tremendous future for this MBA program, are the programs which everybody is studying, and they're all well qualified. See, for example, if you go to a nursing home where there will not be in a position to afford a MBA graduate from big college, working for a nursing home and communicating between, balancing between, and how do they manage? This would be difficult. Those things for the corporates, yes, it is important. For us, the MBA the students of a reputed college like ASCII or ISB are they are the people who are going to drive us through the future of the industry.
There is a kind of a related question from Kavya Velagala. She is saying, do you think that training medical students with AI or machines should start in medical school as a part of their curriculum? Has it already started?
I think they already started and they are on that.
Okay.
Definitely, ma'am. Definitely. As see, even AI has already been implemented, as Mr. Samaraj said right now, that is already been implemented, particularly when teaching subject like anatomy. Often see, during our time when we used to have medicines, we used to have enough cadavers. used to have adequate number of cadavers for studying anatomy and all that. Of late, we don't get, so we have to replace it with something which is artificial. AI has the greatest role to play over here, teaching the intricacies and details of anatomy. Without a basic anatomy, learning the basic physiology of a human body, we cannot advance to the next level of medicine or learning medicines. Medicine is nothing but just an applications of the basics of anatomy, physiology of the human body. So AI has a greater role to play in this part is concerned. Number two, there is something called we are going to have in education, medical education. There's a vertical integrations. So vertical integration is where we start early in the early careers of the students by what they learn in anatomy and physiology into the human body and applications in the future. So they get interested to learn the subject. Otherwise, they'll feel this subject are useless to carry forward. So this vertical integration is very, very essential. And there again, the role of AI comes to play, where we instigate our youngsters to learn the things and carry it forward. So a learned student, when goes forward, has least chance of causing errors, and human errors has no excuse. That's all what I would just like to focus here, ma'am.
Totally agree, especially in healthcare. I think
Sure,
errors
ma'am.
can be fatal. Yes,
Yeah.
thank you so much. One last question from Mr. Ramakant from RBC Worldwide.
Hi, doctors. This very basic question we've been discussing, say, for the last 1 hour. So, where do you draw the line? Because, and as I understand, in fact, one of the Japanese philosophers, contemporary philosophers, mentioned that in every area, every industry, the craft form. Can you hear me?
Yeah, I can hear you.
Yeah, the craft form of any specialty will be replaced by artificial intelligence. Only art form
Yeah.
remains alive, but very roughly, very broadly spoke, which means, for example, whether it's 2 millimeters or 4 millimeters is not only decided but also executed by a machine better than a man, or man in the sense a doctor. So, but the science, the what do you call the scientific temper, will not allow the scientists or the discoverers to understand this realistically and stop somewhere. So they go on. At a stage, probably, like for example, many nowadays car drivers, they don't have to know how to do reverse driving because the car is so intelligent, it parks itself. I'm talking modern cars. So which means at a stage, the driver becomes lesser qualified than the, say, 10 years back driver. But he might develop another kind of skill set. So understand the machine, understand the navigation of the machine, understand technology of the machine, or something like that. So the question is, would such conventional doctors who are there today, trying very hard to understand what is technology, will they remain the same, or I'm not questioning they will become lesser qualified, but what do you call differently qualified at a stage? So the differently qualified doctors not only definitely address the problem with same efficiency, if not more, but would they retain, as you proudly mentioned, that the emotional quality of a typical doctor? That's the question.
Yeah, just at the onset, let me tell you, sir, the what matters is factor A. A is the attitude. And whether it's a traditional doctor or the next generation doctors, if the attitude to learn will be there, we can definitely, I'm sorry. Yeah, I'm sorry, I missed the picture. So once you have the attitude to learn, we'll definitely learn the technology, whatever advanced, whatever things it comes to. And as far as that emotional bondage is concerned, machine will have no replacement to the emotional bondage. And healthcare is one scenario where emotional bondage plays of paramount importance, and
For
it
us,
has got no replacement to it. Pardon? So, and as far as use of technology is concerned, as I told you very precisely, sir, the accountability, responsibility, precision, it will all depends upon the person to implement how precisely is going to implement the knowledge. Machine will guide you. Machine is not predict you exactly values. And we all discussed about the errors what the machine can have. That is what I told you about that black box theories and all that, where the machine has chance of giving you, see, it's all depends upon the data and the robust data what Karan will agree with me what we have fed into the machines, and that will keep on changing from time to time. The disease pattern keeps on changing, the diagnosis keep on changing. Currently scenario we have seen that covid started with one mutations, and over a period of time it changes to six mutations. So similarly, the disease pattern changes, the data has to change. So unless the data is fed in the reform stage from time again, machine not able to guide precisely. So again, it comes to the person, that is the man, the brain. So to interface between his computer brain interfacing. So once the interfacing happens, that is the utility. So the drawing a line is again a controversial issue. It all depends upon the attitude of the person, how far you want to go and take away use of this artificial intelligence and the brains.
Thank you, sir. I extend this question to Mr. Karan. Can I? Today, as I understand, and Alexa can understand what sort of music you like. If it is she, also understands when do you want to hear your music. She can actually predict that there is a new movie. Probably you should see this because you like that movie. The artificial intelligence is now at a stage where it's actually frightening. There is a clear possibility that a machine can speak more articulately. A machine can actually understand that this guy, after taking medicines, will not follow the prescription. It also can understand that this guy will definitely become a diabetic person in a matter of next 2 years. So this is a situation here. So while the picture should be rosy, the picture should be uh, uh, doctor centric, because the human versus human. My belief is 70 to 80% of this is anything which is related to crafty part of it. For example, today I see actually a printed prescription form for corona patients. It's a printed one, which means anybody comes in, you just give the printout. You don't have to write anything. That you don't need a doctor. So machines does a better job there. So what I'm saying is, while we're allowed to understand the importance of, because AIs are the 10 times intelligent than in certain clinical areas, not the interpretation areas perhaps. Maybe interpretation also at a time. But they're exceptionally brilliant. It's frightening. For example, you should go to Google. You must have seen all this. Recently, they made this social. What is the serial, Priya? Social impact or something. Social dilemma.
Social dilemma.
It's scary. Social dilemma. It's a scary thing, actually speaking. They know everything. They know everything about what would be your next holiday. That extent. So while I think Sriram agrees with me, because this maybe 60, 70 years later, probably when we have an opportunity to discuss again, because we live forever, as we know. So the conversation platform will be different. Not a question. Yeah, Priya, I think I can conclude it. Yeah.
So I thought
Yeah,
that was
sir.
a question to Mr. Karan.
Sir won't stop. Somraj won't stop.
Ramakant, I think the question what you asked is unanswerable at this point of the time.
Right.
And when you're asking, I am remembering the Robo movie.
Yeah.
So if you say missions can do perfect job, I don't think it is possible. A mission is driven by a person. So whatever instructions is been given by the doctor, the machine only can do that. As Mr. Karan said, in a MRI or a CT, there are hundreds of parameters out there. in hundreds of parameters, what is correct, what is the requirement of the patient has to be decided by the doctor, and the treatment has to be done by the doctor, and the instructions has to go by the doctor only. See, for example, we have this Electa mission for the radiation oncology. So what that mission is, for the moving organs, also the treatment can be done at the right spot. So that is the mission, that the setting point is done, and identifying that problem is done by the mission, and where the treatment has to be done is the doctor. So I don't see without a doctor the treatment can be done by the patient, and you will not be in a position to directly interlink your mobile tracking system of what the Google and all is doing can be clubbed to this industry, because there is a variance between the patient to patient, the doctor to doctor, everything is changed. So where if you are talking about Alexa, it can understand what kind of music and what time you want, whether in the morning you want Suprabhata or in the evening you want a romantic song. It all depends, it all takes. But here the patient is changed every single time, the treatment is changed every single time, the spot of the treatment is changed every single time, that everything is changed. So there is no question in future or next 100 years also, this will be a change. And as a patient, if I don't go to a mission and ask what is my problem, I having chest pain, what do I do? Does mission will be in a position to give? Maybe it can give the digital thermometer can give a digital temperature of the body. But how my heart is functioning without a doctor? Doctor has to set ECG machine. The technician has to do a technical job. Then the doctor has to read it, and patient cannot read that whether how my heart is working, because he's not technically qualified. The doctor only has to do that. So there is no question. You please remove from your mind thinking that the future, there is no future for the doctors. There is a tremendous future for the doctors. But as Dr. Panigraha says, you have to be upgraded and get learning from the companies like GE and Electa all the time. So you are always with the technology and with the future.
Thank you.
Hope I clarified your.
Assuring it. Thank you so much.
Thank you.
Once again, a big thank you to all our panelists, TVS Somaraju Garu, Dr. V. Jagan Mohan Reddy, Dr. Pradeep Panigrahi, Karan Verma, and Merve Agate for your invaluable observations and your time and your patience in answering so many questions, even very layman kind of questions. And thank you, Sriram, for guiding the conversation so deftly in all the right directions. Thank you, Vicky and Akhilesh Mahurkar, for hosting the event. Thanks to RBC Worldwide for the event branding and coordination, and to all the members of the media for covering the event. Our gratitude to all of you in the audience for joining us here today. Wishing you all a very, very happy and healthy Dasara Diwali season that's coming up. May the powers be hurry up and vanish the scorch